When you're going to travel to Africa, make sure that you know of all the outbreaks that are going around. If you want to keep yourself from getting sick, make sure that you wash your hands frequently. And if you're going to be looking at the wildlife, make sure that you avoid contacting, uh, going across bats and monkeys. They are known to have the Ebola virus, most likely. And most of the Ebola virus is actually, if you're going to be traveling, make sure that you notice that most of Africa's central and western areas are affected with the Ebola virus.
Ebola is a disease of humans and other primates caused by an Ebola virus. Ebola virus is the sole member of a serious Ebola virus species and the most dangerous of 5 known viruses within the genes of Ebola virus. 4 of the 5 known Ebola viruses cause a severe and often fatal hemorrhage fever in humans and other primates known as the Ebola virus disease. The Ebola virus and its species were both originally named for Zaire, the country where it was first described and was at first suspected to be a new strain of a closely related Marburg virus, and the disease spread from bats, particularly big bats. It is transmitted between humans and from animals through body fluids.
Ebola is a rare but deadly virus that causes bleeding inside and out of the body. Sometimes it's hard to tell if a person has Ebola from the symptoms alone. Doctors may test to rule out the disease. Tests of blood and tissue also can diagnose Ebola. This virus is transmitted from wild animals and human to human transmission. There is no specific treatment yet for this disease. Symptoms of Ebola are fever, headache, joint and muscle aches, weakness, diarrhea, vomiting, stomach pain, lack of appetite, a rash, red eyes, hiccups, cough, sore throat, chest pain, difficulty breathing, difficulty swallowing, bleeding inside and out of the body.
The Ebola virus seems to be a zoonotic virus residing in the rainforest on the African continent and in the western Pacific. Some studies have shown that bats experimentally infected with Ebola do not die. This relatively new discovery has raised speculation that bats play a role in maintaining the virus in tropical rainforests. In 2008, approximately 1,850 cases with over 12,000 deaths have been documented since the Ebola virus was discovered, most of which came from Africa. Now Nigerian health authorities are in the progress of treating more than 30,000 people who could be at risk of contracting Ebola after the virus surfaced in Lagos. It is unlikely that the current outbreak would spread to the U.S., while the only example of transmission of Ebola in the U.S. came with the importation of research monkeys. No humans were sickened. For most people, the risk of getting Ebola is low. Risk increases if you travel to Africa, conduct animal research with monkeys imported from Africa or the Philippines, provide medical personnel, or prepare bodies for burial. People who have died of Ebola are still contagious. The virus almost died out by the end of April before making a huge comeback in May and June.